Come in.
Hi, Miss Williams. How are you? Let me take a look at your armband. Very good. My name is Kim. I'll be doing a neurological assessment on you today. Is that okay?
Yes.
Okay, I'll start out by asking you a couple of questions. Can you state to me your first and your last name?
Tamara Williams.
Okay. And what is your date of birth?
05/13/2001.
And what today's date is?
October the 25th, 2020.
Okay, very good. Okay, the next thing I want to do is ask you, I'm going to ask you to give me a relationship between an apple and an orange. How are they alike?
They both fruits.
Very good. That is called abstract thinking. And you gave me abstract, and it was relevant thinking. Okay, the next thing I'm going to do is I'm going to hand you these instructions. I want you to read them and follow what they ask you to do. Okay. Very good. This tests your general knowledge. This test is for your comprehension. The next one I'm going to ask you, who was the first president of the United States?
George Washington.
Okay, now I'm going to observe your cognitive ability. I'm going to ask you to memorize 3 words: apple, bicycle, and rabbit. Can you please repeat those for me?
Apple, bicycle, and rabbit.
Okay. Now I want you to give me a history of a past event in your life. Let's say your 16th birthday.
I had a surprise birthday party, and all my family was there, and we all got in the pool.
Everybody?
Yes, everybody.
Oh, wonderful. Okay, now can you repeat back to me those 3 words that I gave you?
Bicycle, apple, and rabbit.
Very good. Okay, Ms. Williams, now I'm going to assess your cranial nerve 1. I'm going to ask you to clear your nostrils for me. Okay. What I want you to do is close your eyes, and then I'm going to hold one nostril closed, and then I'm going to want you to identify the scent in which you smell, okay? And close your eyes. Lean forward from me. Sniff. Sniff. Okay, very good. Okay, Ms. Williams, I would like for you to stand over here. We're going to test your cranial nerve 2. This is testing your optic. What I would like you to do is, there's a Snellen chart here that is approximately 10 feet away from you. It's the diameter of the chart is actually for 20 feet, but it's arranged to assess at a 10 feet distance. It's a piece of paper here we'd like you to have to cover your right eye for me, please. And then we're going to start off with the smallest line first, and if you cannot read that, just let me know. Line 9.
No, I cannot read that.
Okay, we're going to move to line 8.
No, I cannot read that.
Okay, let's try line 7.
FELOP
switch eyes for me, please. Okay, we're going to try now. We're going to try again with the smallest line, which is line 9.
No, I cannot read that.
Line 8.
No, I cannot read that.
Okay, let's try line 7 again.
FELOPCD.
Okay, Miss Williams, your eyesight is 20/32, which means you're reading that line at a distance that a normal vision would be able to read it at 32 feet. Mm-hmm. So again, you may need to see your eye doctor. Just pause. Okay, thank you, Miss Williams. Before you have a seat, I'm going to hand you this newspaper, and you can have a seat. I would like for you to read this line. Cover your right eye again, and hold it at a distance of 14 centimeters, and read off this first line for me, please.
For our everyday business purposes.
Okay, cover your left eye. Read off this sentence for me, please.
For our marketing purposes.
Keep moving.
To offer our products and services to you.
Okay, very good. That tests also for your cranial nerve 2, which is your optic nerve. Okay, Ms. Williams, now I'm going to test your visual field of confrontation. I'm going to ask you to cover your right eye. I'll cover my left eye. And I want you to tell me when you see the item.
I see it. I see it. I see it.
Okay, your next eye.
I see it. I see it. I see it.
Okay, very good. Okay, Ms. Williams, you can have a seat. I'm going to assess you. Normally, I would use ophthalmoscope. Unfortunately, I do not have one. But with the ophthalmoscope, I would look into both eyes. I will look at the right eye first, and then I will check for your retina and optic disc of each eye. The normal range would be your round red reflexes present. Optic disc is 1.5 millimeters. Round or slightly oval, well-defined margins, creamy pink with polar, physiologic cup, retina is pink. Okay, Ms. Williams, now I'm going to check for your access your cranial nerve 3. I'm going to assess for your ocular motor, your cranial nerve 4, which is your trochlear, and your cranial nerve 6, which is your abducens. I'm going to inspect the margin of the eyelid of each eye. Just take a look at it for me. Don't squint, please don't squint. Okay. The eyelid covers about 2 millimeters of the iris. Now, Ms. Williams, if you'll stand up for me, I'm going to test the 6 corner fields. Follow the pen light for me. Do not move your head, just your eyes only, please. Very good, thank you. This test tests your cranial nerves 3, and I'm going to also test for your cranial nerve 4. Your cranial nerve 3 is your ocular motor. Cranial nerve 4 is your trochlear, and cranial nerve 6 is your abducens. Okay, so for your 6 cardinal fields, your eye movement was smooth and coordinated with motion in all directions. I'm going to check for your pupillary response. Okay. Look straight ahead for me. Very good. You did have bilateral illuminated pupils, which constricted simultaneously. Pupils opposite the one illuminated did constrict also simultaneously. Now I'm going to check for your cranial nerve 5, which is your trigeminal. I'm going to test for your motor functions. So I'm going to ask you to clench your teeth while I palpate your temporal and your masseter muscles for contraction. Clench down. Just clench down. Bite down for me. Very good. Bite down for me. Very good. The temporal and masseter muscles did contract bilaterally. Okay, Miss Williams, now I'm going to test your sensory functions. So I'm going to touch you on an area of your face, on your forehead, your cheek, and your chin with different objects. I would like for you to tell me whether it's sharp or dull, and also tell me where in that location I'm touching you at that time, okay? So I'm going to ask you to close your eyes. And I'm also going to test it with a light touch as well. Okay? Tell me where and what type of sensation you feel.
Dull on my forehead. Dull on my chin. Sharp on my cheek. Sharp on my chin. Dull on my cheek. Sharp on my forehead. Soft on my chin. Soft on my chin. Dull. Soft on my cheek. Soft on my forehead.
Very good. The client correctly identifies sharp and dull stimuli and light touch to the forehead, cheeks, and chin. The next I'm going to do, I'm going to test your cardinal reflex. I'm going to ask you to look away and up while I lightly touch your cornea with a fine wisp cotton. Look up and away from me. Just look up with your eyes. Look at my fingers over here. Okay. Same thing. Look over here. Very good. The eyelids blink bilaterally. The next I'm going to do, I'm going to test your cranial nerve 7. This test is going to test your motor functions. I'm going to ask you to smile for me. I'm going to ask you to frown. Very good. Now show me your teeth. Very good. Now puff your cheeks. Very good. Now purse your lips like kissing. Very good. Raise your eyebrows. Very good. Now close your eyes tightly while I do it again for me. Very good. The client smiles, frowns, wrinkles forehead, shows teeth, puffs out cheek, purses lips, raises eyebrows, and closes eyes against resistance. Movements are symmetrical. Okay, Ms. Williams. Also, there's another cranial test that I could do. It's cranial nerve 7. It's routinely not tested, but I will perform the test on you. What I'm going to do is I'm going to ask you to identify the flavor in which I put on your tongue. I would like for you to identify the flavor.
Lemon.
Very good. The next I'm going to test for your cranial nerve 8. Okay? In this test, I'm going to test your acoustics. I don't have a tuning fork, but I will use an instrument to represent a tuning fork. In this instance, I'm also going to do the Weber test, that's the tuning fork, and the Rhine test to identify the cochlear components and cranial nerves of 8. So if this was my tuning fork, what I will do is I will place it on here, and I'll place it on your mastoid bone, and then I will place it against your ear, and then you will tell me if you continue to hear that sound. Then I'll place it on your forehead here, and you'll tell me when you hear the sound. That indicates if you do perform that test well, you would hear the vibrations equally well in both ears. Now I am going to be able to do the Rhines test. I'm going to be able to do the Webster test. I'm going to whisper something in your ear, and I'd like for you to tell me what I said.
Softball. Macaroni.
Very good. The client hears the whispered words from 1 to 2 feet during the Weber's test. And during the Rhines test, it was given an example which conduction is twice as long as bone conduction. Okay, Miss Williams, I'm going to test now your cranial nerve 9 and 10. This is your glossopharyngeal. It's going to test your motor functions. Okay, I'm going to ask you to open your mouth and say ah while I press down with the tongue depressor. Say ah.
Ah.
Very good. The uvula and soft palate rise bilaterally and symmetrically on phontonation. Okay, now I'm going to test your posterior gag reflex. I'm going to test your gag reflex by touching your posterior pharynx with the tongue depressor, okay? Open your mouth. Very good. That's exactly what a gag reflex is. The gag reflex was intact. Okay, Miss Williams, now I'm going to check your ability to swallow. So I'm going to ask you to take a sip of water for me. Very good. The client swallows without difficulty. Can you say mountain?
Mountain.
Very good. No hoarseness noted. Now I'm going to assess you for your cranial nerve 11. I'm going to ask you to shrug your shoulders against my resistance to assess the trapezius muscles. Very good. The client, there is symmetry and strong contractions of the trapezius muscle. Very good, Miss Williams. Now I'm going to ask you to turn your head against resistance. First to the right side and then to the left side to assess your sternocleidomastoid. Okay. Turn. Very good. Turn. Very good. There's a strong contraction of sternocleidomastoid muscle, the side opposite the turn face. Now I'm going to assess your cranial nerve 12. This is your hypoglossal. I'm going to assess the strength and mobility of the tongue. I'm going to ask you to protrude your tongue and move it to each side against the resistance of the tongue depression. And then put your tongue back in your mouth. Okay. Stick your tongue out for me. Turn it to the side of the blade. Very good. Stick your tongue out for me. Turn your tongue. Very good. The tongue movement is symmetric and smooth, and bilateral strength is apparent. Okay, Ms. Williams, I'm going to ask you to stand up. I'm going to now observe your motor and cerebral system. I'm going to test your condition and movement of your muscles. So I'm going to observe your posture. Could you stand up straight with arms down to the side? Thank you. The posture is erect and comfortable for age. Now I'm going to ask you to walk from that end of the room towards me at a normal rate and speed. Very good. The weight of the patient was evenly distributed, and client was able to stand on heels and toes pointed straight ahead, equal on both sides, posture erect, movement coordinated and rhythmic, arm swinging in opposition, and stride length appropriate. Okay, Ms. Williams, you can have a seat. Okay, now I'm going to inspect and palpate the tibular-mandibular joint. I'm going to have you, I'm going to put my index and middle finger just anterior to your external ear opening. Okay. Now I'm going to ask you to open the mouth as wide as possible. Very good. Very good. Move the jaw side to side for me. Very good. Now I want you to protrude out and retract. Very good. The snapping and clicking may be felt and heard in the normal client, and it was. And your mouth did open 1 to 2 inches in distance between each other. And your jaw moves laterally 1 to 2 centimeters. And the jaw protruded and retracted easily. Okay, Ms. Williams, I'm going to test your range of motion of your jaw. I'm going to ask you to move the jaw laterally against resistance, okay? Laterally. Go ahead. Okay. The jaw was full range of motions of resistance. Contraction palpated with no pain. Did you have any pain? And I felt no spasms. Did you feel any spasms? No. Okay, very good. Okay, Ms. Williams, I'm going to test the range of motion of your cervical spine. I'm going to ask you to put your chin to your chest. That's flexion. Okay. And then I'm going to ask you to look up to the ceiling. That's hyperextension. Very good. The patient flexion of the cervical spine is 45 degrees, and extension of the cervical spine is 45 degrees. Now I'm going to test your lateral bending. Going to ask you to stand up for me. I'm sorry, you don't have to stand. I want to ask you to touch your ear to your shoulder on the right side. And I'm going to ask you to touch your ear to your shoulder to your left side. Very good. The client did bend at a 40 degree to the left side and 40 degree to the right side, and that is normal. Now I'm going to ask you to turn your head to the right and turn your head to the left, and that is evaluating your rotation, and it did rotate about 70 degrees, which is normal. Okay, I'm going to ask you now to do the same thing. Turn your head to the right to resistance and to the left. Very good. Now the client had full range of motion against resistance, and the strength was 5 to 5. Now I'm going to test your range of motion from your spine. I want to ask you to stand up for me. I want to ask you to bend over and touch your toes. Very good. That is flexion, and it did arrive at a 75 to 90 degree angle and was smooth. The lumbar concavity flattened out, and the spinal process are in alignment. Now, Ms. Williams, I'm going to sit behind you, and I'm going to ask you, I'm going to hold my hands on your pelvis. Face this way from me. Turn that way. I'm going to put my hand on your pelvis. I'm going to ask you to bend sideways, lateral bending, and then backward. Your back, your full back. Very good. And twist the shoulders one way, then the other. Very good. Okay, the lateral bending capacity of the lumbar, of the thoracic and the lumbar spine should be about 35 degrees, and hyperextension about 30 degrees, and rotation about 30 degrees. And it was. Now, Ms. Williams, I'm going to check for your range of motion of your arms and your shoulders and your elbows. I'm going to check for flexion, extension, abduction, adduction, motion to resistance, against resistance. Can you stand with your arms down to your side for me, please? Now I'm going to ask you to move your arms forward for flexion and backwards with your elbow. This is forward, and then this is backwards. Very good. Now I'm going to ask you to bring both hands together above your head and your elbows straight. No, just like around motion. Straighten your elbows for me. Very good. Okay, Ms. Williams, now I'm going to have you bring both hands together over your head with your elbows straight, followed by the moving both hands in front of you your body past the midlines with elbows straight. This test for adduction and abduction. Bring your head above your head, put your elbows straight, and then bring them down above you, in front of you, with your elbows straight. Very good. The client extends a forward flexion, was about 180 degrees hyperextension and 50 degrees adduction, and 50 degrees and abduction was 180 degrees. Now I'm going to ask you to continue the motion with the client, hands together, bring the head and elbow flex. Okay, Miss Williams, now I'm going to have you bring both hands together over your head with your elbows straight, followed by the moving both hands in front of you with your body past the midlines with elbows straight. This test for adduction and abduction. Bring your head above your head, put your elbows straight, and then bring them down above you, in front of you, with your elbows straight. Very good. The client extends a forward flexion, was about 180 degrees hyperextension and 50 degrees adduction, and 50 degrees and abduction was 180 degrees. Now I'm going to ask you to continue the motion with the client, hands together, bring the head and elbow flex. Okay, Ms. Williams, in a continual motion, I would like you to bring your hands behind your head with your elbows flexed, and then behind your back, and complete these maneuvers against resistance. Okay. So I want you to bring your hands behind your head.
Can you demonstrate, please?
And then behind your back, like this. Okay, do it once more again behind your head. No, I need you to bring your arms up and behind your head. Up and behind your head. Do it again. Up. Very good. And then behind your back. I'm sorry. Do it again. Do it again. Now, Ms. Williams, I'm going to inspect your elbows and test for range of motion. I'm going to ask you to follow my movements to the text of range of motion, flexion, extension, pronation, and supination. The extent of external and internal rotation should be at a 90 degrees respectively. And the client can flex, extend, adduct, rotate, and shrug shoulders against resistance. Now, Ms. Williams, I'm going to test your elbows. I'm going to test for range of motion. I'm going to ask you to perform the following movements. The test for range of motion of flexion, extension, pronation, and supination. Okay. So for the flex of your elbow, I want you to bring your hands to your forehead. Okay. Now straighten the elbow. Very good. And then I'm going to hold your arms out, turn the palms down, and then turn the palms up. Very good. Now last, I'm going to have you to repeat this movement against resistance. Flex the elbow and bring them to your forehead. Very good. Now I'm going to ask you to then hold your arms out and turn your Very good. Very good. Now I'm going to ask you to okay, Miss Williams, now I'm going to test the range of motion of your wrist. I'm going to ask you, step back for me. Just a little bit. Okay, I'm going to ask you to hold your arms out towards me, and I'm going to flex and extend going downward and upward. Very good. Now I'm going to ask you to keep them out straight for me and bring them inward and outward. Very good. Now I'm going to do those same motion, downward to resistance and then upward to resistance. Very good. Inward to resistance. Just your wrist, ma'am. I'm sorry. And out. Very good. Normal range of motions are 90 degrees of flexion, 70 degrees of hyperextension, 55 degrees of ulnar deviation, and 20 degrees of radial deviation. And the client did have full range of motion. Now, Ms. Williams, I'm going to test I'm doing a Fallon test. This test for carpal tunnel syndrome. I ask you to place the back of your hands together, both together, against each other while flexing at a 90 degree with your fingers pointed downwards and wrists dangling. And I'm going to have you hold that for 60 seconds. It's like this. No, yeah, okay, very good. Did you have any tingling, any numbness, any burning or pain? Very good. And there was no tingling, there was no burning. Now I'm going to test for T-Now sign. And this is what I'm going to do is I'm going to percuss lightly over the medium nerve located on your aspect of your wrist. Okay, Miss Williams, now I'm going to test the range of motion of your hand and your fingers. I'm going to ask you to spread your fingers apart. Okay, now hold your, make a fist. Very good. Now bend the fingers down and then back up. Very good. And now I'm going to ask you to move your thumb away from your rest of your fingers on both hands. Very good. And then I'm going to ask you to touch your thumb to your smallest finger. Very good. Now I want to do that same thing, and I want you to do it to resistance. Okay. Hold your hand. Close your fingers first. Spread them apart to resistance. Now make a fist. Very good. Now bring your arms down and back up. Very good. And then bring your, make a four. So I do it here. Bring it down. Very good. And touch your, very good. The normal range of motion was 20 degrees of abduction, full adduction of fingers touching, 90 degrees of flexion and 30 degrees of hyperextension. The thumb was easily moved away from the fingers, and 50 degrees of thumb flexion is normal. The client has full range. The client, did have full range of motion. Okay, Miss Williams. Now I'm going to test your range of motion of your hips. Could you have a seat for me, please? I'm going to elevate the chair, okay? Okay, so what I'm going to do now is I'm going to ask you to extend your leg to about a 45-degree angle, and your other leg. You might have to raise your dress up some. Okay, raise your leg, which is straight out. Straight out your leg, very good. Now I'm going to ask you to flex your knee up to the chest while keeping other legs extended. Very good. Now I'm going to ask you to move your leg away from the body, and then the other leg. Then I'm going to ask you bend your leg inward, and then the other leg. Now I'm going to ask you to turn around and lift up one leg, then the other. I'm going to do this to resistance. Do it, lift the leg, very good, lift the leg, very good. Turn again for me. Same thing to resistance, lift right leg, left leg, bend it, very good. These tests were testing for your leg extension, abduction and adduction, rotation, and the normal range of motion is 9 degrees of hip flexion with the knee straight, and 120 degrees of hip flexion with the knee bent and the other leg remaining straight. The normal range of motion is 45 to 50 degrees of abduction, 20 to 30 degrees of adduction, 40 degrees of internal hip rotation, and 45 degrees extended hip rotation, and 15 degrees hip hyperextension. The full range of motion against resistance was strength was 5 to 5. Now, Ms. Williams, I'm going to test the range of motion of your knee. I'm going to ask you to bend each knee for flexion towards the buttocks, and then back, and then straighten the knee for extension and hyperextension. So could you stand up for me, please? So bend each knee up, this one, and the other, and then back, like this. Very good. Now I'm going to do these to resistance. Could you bend that knee up for me? That one up for me. Again. Very good. The normal range is 120 to 130 degrees of flexion and 0 degrees of extension to 15 degrees of hyperextension. And the client did have full range of motion against resistance. Now, Ms. Williams, I'm going to test for range of motion over your feet and your toes. You can have a seat for me, please. Now, what I'm going to ask you to do is I'm going to ask you to point the toes, dorsiflex them up and down for me, and down. Okay. Then I'm going to ask you to turn your soles outward and then inward. That's eversion and inversion. Very good. Now I'm going to ask you to rotate your foot abduction and then inward adduction. What are you doing? Okay, Miss Williams. Now I'm going to test the range of motion of your ankles and your foot. I'm going to ask you to point your toes upward, which is dorsiflexion, and then downward. Upward and then downward. Very good. Now I'm going to ask you to turn the soles outward, which is eversion, and then inward, which is not like this. Right. Like this, babe. Okay, next I'm going to ask you to turn the soles of your feet outward, which is eversion, and then inward, which is inversion for abduction. I'm sorry, inward, which is adduction. Point your feet this way. Now turn. Yes, thank you. Now I'm going to ask you to turn your toes under your foot, which is flexion. That's bending your foot down like this, and back up, which is extension. Put your toes downward to the floor, the whole, and then upward. Very good. So normal range is 20 degrees dorsiflexion and ankle and foot, 45 degree plantar flexion of ankle and foot, 20 degrees of eversion and 30 degrees of inversion, 10 degrees of abduction and 20 degrees of adduction, 40 degrees of flexion and 40 degrees of extension. The client had full range of motion. Okay, Miss Williams. The relaxed muscle contract voluntary and show mild, smooth resistance to passive movement. All muscle groups are equally strong against resistance without flaccidity, spasticity, or rigidity. Now I'm going to, also there was no fasciculation, tics, or tremors noted. Now I'm going to assess your gait. Make sure that we did do the walking to assess that, but I have to test for your balance. So I'm going to ask you to walk with your heel to your toe, moving towards me. Very good. The client balance with tandem walking, walks on heels and toes with little difficulty. Now I'm going to perform the Romberg's test. I'm going to ask you to stand erect with arms at side and feet together for me. Okay, and now I'm going to ask you to stand erect with your arms at your side. Very good. And with your feet together. Feet together. Okay. Then I'm going to ask you to maintain that same body position and close your eyes for 20 seconds. You're supposed to stand as still as possible. Okay. The client stands erect with minimal swaying, with eyes both open and closed. Now I'm going to ask you to stand on one foot and then bend the leg and then I'm going to ask you to hop on one foot. Bend one leg and hop. Okay, that's fine. So this is one time. Bend the next leg and then hop one time. Very good. The client bends knee while standing on one foot, hops on each foot without losing balance. Now I'm going to assess for your coordination. I'm going to ask you to demonstrate this by putting your finger to your nose to assess for accuracy movement. Then I'm going to ask you to extend and hold arms out to the side with eyes open. Now I want you to you're going to hold your arms out and you're going to hold your arm out and you're going to put your finger to your nose. Okay, now I would like you to close your eyes. Put your right finger to your nose. Keep your eyes closed. Keep your arms, your head straight, and put your left finger to your nose. Very good. Okay, Miss Williams, now I'm going to assess you for your coordination. What I would like you to do is put your arms to your side like this, and then I'm going to ask you to put your finger to your nose 3 times without swaying over your head. Okay, you ready? Put your arms out to the side. 1, 2, 3. Very good. The client touches finger to nose with smooth, accurate movement with little hesitation. Now, Ms. Williams, I would like now for you to do that with your eyes closed. Very good. Again, the client touches finger to nose with smooth, accurate movement with little hesitation. Now I'm going to assess for rapid alternating movements. I'm going to have you sit down for me. Now I'm going to ask you to touch each finger to the thumb. Now I would like you to do that again, faster, at a faster pace. Very good. Now I'm going to ask you, this is assessing for rapid alternating movement. The client touches each finger to the thumb rapidly. I'm going to ask you to put your palms on your hands on your thigh for me. And then I'm going to ask you to turn your palm up and turn them down again. Okay, now I'm going to ask you to increase the speed. Keep going. Very good. Okay. The client rapidly turns palms up and down. Now I'm going to ask you to perform the heel to shin test on both legs. Very good. The client is able to run each heel smoothly down each shin. Now, Miss Williams, you can have a seat back right here for me. Now I'm going to assess light touch, pain, and temperature sensation. For each test, I'm going to ask you to close your eyes, and I would like you to tell me, what do you feel? I'm going to scatter the stimulus over the distal and proximal parts of all extremities and to the trunk to cover most of the dermatomas. It is not necessary to cover the entire body surface unless you identify abnormal symptoms such as pain and numbness and tingling. Okay? First, I'm going to start with your arms. Okay, close your eyes for me. Please tell me where I'm touching you and how does it feel?
My arm, it feels sharp.
Okay, Miss Williams, I'm going to assess your light touch, pain, and temperature sensation. I'm going to ask you to close both eyes, and then I would like for you to tell me what do you feel and where do you feel it. Okay. Close your eyes for me. I'm going to assess proximal and distal points.
Arm and dole. Hand and soft. Arm and dole. Arm and soft.
Okay, Miss Williams, I'm going to assess now your light touch, pain, and temperature sensation. So what I'm going to do is I'm going to ask you to close your eyes, and then I'm going to test a part of your body, and I would like for you to tell me what do you feel, okay? And tell me where you feel it at. Close your eyes for me.
Sharp and on my arm. Soft and on my hand. Sharp and on my arm. Dull and on my hand. Soft and on my arm. Sharp and on my leg. Soft and on my leg. Soft and on my leg. Sharp and on my leg.
I'm sorry, you have to tell me which part of your leg.
The top part.
Your thigh.
Yes, ma'am.
Okay, let's try it again.
Sharp and on my thigh. Dull and on my thigh. Dull and on my lower leg. Okay. Soft and on my thigh. Soft and on my.
I'm sorry, say it again.
Soft and on my leg.
Your leg or your thigh?
No. Dull and on my chin. Cold and on my thigh. Cold and on my lower leg. Hot and on my thigh. Hot and on my lower leg.
Very good. And usually this test would be performed if you had any, the temperature test is usually performed when there's abnormal findings or the client's inability to perceive light, touch, and pain sensation. The client correctly identified sensations. Now I'm going to test for the vibration. Now normally with this test I will use a tuning fork, and I don't have one, but I will strike the tuning fork part of my tuning fork and put it on your heel of your foot. Raise your foot up for me, please. The heel of your foot. I'm sorry. I will strike my tuning fork and put it on the heel of your foot, and then I'll for the test vibratory sensation, I will actually strike strike a low pitch tuning fork on the heel of your hand and hold the base of the distal radius and your forefinger tip and your medius malleolus, and last the tip of your greater toe. And then I will ask you to indicate what you feel, and I will repeat this for both sides. But I do not have a tuning fork, but I would strike it and I will place it on your the heel of your hand. And then I would strike it and I will put it on your forefinger tip. And then I would strike it and put it on your medial malleolus. Then I would strike it and put it on your great toe. And I would do that to both sides.
Oh, okay.
And I would ask you, what would you feel? What you feel? And again, I repeat that on both sides. And the vibrational sensation should be intact distally and proximally. Now I'm going to ask you to close both eyes. I'm going to test for sensation to position. Then I'm going to ask you, clients, I'm going to move your finger and your toes up and down, and I would like for you to tell me which direction I'm actually performing this on your finger and your toes. Hold your hands out for me. Close your eyes. Hold your hand out.
Down. Up. Up. Down. Up. Down. Up.
Very good. The crime correctly identified directions of movements. Now I'm going to assess the tactile discrimination. I'm going to ask you to close your eyes, and I'm going to test stereogenosis. I'm going to place a familiar object in your hand, and then I would like for you to tell me what they are. I'm going to repeat this with both hands, okay? Close your eyes for me, please, and hand me your hand. Could you please describe to me what that is?
A key.
Very good. Again.
A Q-tip. A coin.
Okay. Let me get your left hand.
A Q-tip. A coin. A key.
Very good. The client correctly identifies the objects. Okay, Ms. Williams. Now I'm going to test for your bicep reflex. Could you come towards me? And I'm going to hold your elbow here. And I'm going to evaluate the functions of your spinal nerves C5 and C6. Very good. The elbow flexions and contractions of the biceps muscles is seen on both left and right arms and ranges from 1 to 3. The forearm flexes and supination ranges from 3 plus to 1 to 3 plus. Okay. Now I'm going to assess your brachioradialis flexion. Okay. I'm sorry. Are you relaxed? Very good. Very good. The flex and supination of your forearm. The forearm flex and supination again ranges from +1 to 3 plus. Now I'm gonna do your tricep reflex. I'm gonna ask you to hold your arm freely down while your arm rests on me, and then I'm gonna with the flat part of my hammer, I'm going to tap the tendon above the oleocranial process. And I'm going to repeat this to both sides. And this is going to test your spinal levels of C6, C7, and C8. Hold your arm. Rest it. And you resting? Very good. The elbows extends, tricep contracts, ranges from 1 plus to 3 plus. Now I'm going to test for your, assess for your patellar reflex. I'm going to ask you to hang your legs freely off to the side and examine those reflexes using the flat side of my hammer. I'm going to tap your patellar tendon, which is located just below the patella. And then I'm going to repeat this to both sides and gently tap. And then I'm going to evaluate your spinal levels L2, L3, and L4. Okay. Okay, sit back as much as you can for me. And your legs are freely hanging. Very good. The knee extends, quadricep muscle contracts, and ranges from 1 plus to 3 plus. Now I'm going to do this position in a supine position. Okay, I'm going to lay you back. Okay, again, the knee extended, quadriceps muscle contract and ranges from 1 plus 3. Now I'm going to do the Achilles reflex. I'm going to hang your legs again freely. I'm going to dorsiflex the foot. I'm going to tap the Achilles tendon with the flat side of the reflex hammer. And I'm going to repeat this for both sides. And I'm going to be assessing the reflex in the client if I were. Okay.
I'm supposed to be relaxed.
Yes. Just hold it back. Do you feel a jerk? You are?
Yes. Relax.
Okay, very good. Normal response is plantar flexion of the foot, ranges from 1 plus to 3. Now I'm going to do the ankle clonus. When the other flexion tests have been hyperactive, place one hand under the knee to support the leg. When briskly dorsiflex the foot toward the client's head. Now I'm going to also put you in a supine position, and I'm going to test the Achilles again. Very good. And the other one. Very good. Now I'm going to test your ankle clonus. Now I'm going to test for ankle clonus. Hold your hand. Relax. Relax. No rapid contractions or oscillations of the ankle are elicited. Now I'm going to test for superficial reflexes. Okay, I'm going to assess for superficial reflexes and assess for plantar reflexes. With the end of my hammer, I'm going to go across the lateral aspects of sole from the heel to the ball of the foot. Put you across your feet and put. And the other. Pause and restart. Okay, now I'm going to test for your superficial reflex and your plantar reflex. With the end of the hammer, I'm going to stroke the lateral aspect of your sole of your heel to the ball of your foot, curving immediately across the ball. And I'm going to repeat this to the other side too. This is going to evaluate your function on your spinal nerves L4, L5, S1, and S2. Okay. Flexion of the toes occurred. Plantar response. Now I'm going to test for abdominal reflex. I'm going to lightly stroke the abdomen on each side and above each of the umbilicus to evaluate the functions of the spinal 8. To evaluate spinal levels T8, T9, and T10 with the upper abdominal reflexes and the spinal level T10, T11, and T12 with the lower abdominal reflex. Okay, lift your shirt up, dress up for me, please. Relax. Very good. The abdominal muscle contract, the umbilicus deviated towards the side, being stimulated. If I was testing a male, I would do the chemostatic reflex in males. Okay. Now, Ms. Williams, I'm going to test you for meningitis. If you were to have it, I'm going to just go through the routines of what would happen. Could you stand up for me, please? I will ask you to do you remove the jacket for me? Go. Okay, I will ask you to flex your neck. Put your arms down to the side and flex your neck. And as you flex your neck, I would watch for your hip and knees in reaction to your maneuver. Normal is hips and knees remain relaxed and motionless. But if there was any pain and flexion of the hips and knees, a positive Burkinsky sign, and that would suggest you may have a meningeal infection. And then I would test for King's 9 sign. This is you flex the leg at both the hips and the knee, then straighten the knee. So I will flex the leg at both the hips and the knee, then straighten the knee. If there's no pain is felt or discomfort behind the knee during full extension occurs in many normal people, but pain would increase resistance to extending the knee or positive Kerning sign. When Kerning sign is bilateral, the examiner suspects meningeal irritation. Okay, Ms. Williams, you may have a seat. I would like to thank you for your time, and I would like to thank you for your allowing me to do your assessment. Is there any questions that you'll have? Okay, thank you and have a good day.